Tell me what brings you here.
Lower back problem. A lot of pain in my lower back since 2004.
Okay. We're 2019.
Yeah, 2019.
So this is 15 years.
15 years, yeah. And
what were you doing? Let's rewind.
Yeah, I was back at school, just trialing
High
out.
school?
Sorry, high school. Yeah,
okay.
yeah. Trialing out shot put in the ground.
Okay.
Soon as I threw the ball, right, my back twisted and my feet got stuck in the mud.
Your right side twist. You
Right
twisted
side twisted,
right,
yeah.
so you're right-handed.
Right. Yeah.
You're
Right-handed.
shot putting.
Yeah.
Okay.
So that's how it twisted, and that's when I felt that something's happened. And I've been in pain since. I was on bed rest for like totally 6 months.
Standard shot put. How many kg?
Can't exactly remember.
2, 3, 4.
More than 10, I'm guessing.
More than 10
yeah,
kg.
More than 10 kg. It
Okay.
was pretty heavy. Yeah.
So you're going like this,
Yeah.
and you felt it pop before you released the shot put?
Before I released, yeah.
So before you released it?
Yeah.
Okay. And prior to that, did you have any injury?
Nothing at all.
No issues?
Nothing at all.
Practice, everything has been good?
Absolutely fine. Yeah.
What other things were you doing sports-wise besides shot put?
Just standard weightlifting.
Okay.
I used to be a gym freak, so yeah, I was found more at the gym.
You're coming from where?
From UK.
From UK. What part of UK?
Birmingham.
All right.
Yeah.
Birmingham. I haven't been there yet.
You haven't,
No,
right?
no, just
Well,
London.
welcome,
Just
maybe.
London. One day, maybe. Let's see.
Sure.
Okay, so main injury, main reason you're here.
Yeah.
15 years ago, you were practicing shot put.
Yeah.
You're about to release, and as you're releasing, you feel a pop in your back.
The back, yeah.
What did you do for it?
I went to quite a few doctors, right? Everyone's suggesting surgery. I'm not a person who
In high school?
in high school time. Yeah.
Surgery for what? What did they diagnose? What did they find?
What they found is something's cut, the fluid inside the spine that's actually popped out.
So a herniation?
Herniation,
you had
yeah.
a herniated disc?
Yeah.
You remember the level? L5, L4?
L5S1.
L5S1?
Yeah.
Okay.
And that's where it was. And recommended surgery by quite a few people. I'm not the type of person who will agree to cutting the body, so
Okay.
I didn't agree on that.
So what have you been doing for 15 years?
Well, immediately I was on complete bed rest for 6 months. I didn't move.
Okay.
So just sort of.
For a herniated disc, you were recommended 6 months of bed rest?
I was just told to rest or surgery, so
Okay.
sort of went along with whatever I felt was fine.
And maybe this was 15 years ago.
Yeah.
So the old mentality was bed rest.
Bed rest, yeah.
That's not
Sort
what
of
we
anymore.
recommend anymore.
Yeah.
What's
the movements, isn't it?
Exactly.
Yeah.
So the idea back then is, we doctors used to say get bed rest if you have back pain.
Correct. Yeah.
Now we know what.
Yeah.
Body heals with
Yeah.
movement and motion. And why specifically in the spine? Because you need that movement for the process of inhibition, right? To get things moving. Okay. So you've been dealing with it then?
Yeah. Since then, I've been dealing with the pain. I've been taking regular painkillers.
Okay.
Ibuprofens. When it gets worse, I take 2 at a time.
Okay.
So while driving, I keep a pillow around my back. Just sort of try and.
All left side, right side? Because you started on the right earlier.
Yeah. How I feel better is if I say press my back from this side more in towards right. I'm not sure what's your right.
So it's you
feel
feel a relief if you push on your left side, and you're pushing from out in.
Yeah.
And can we point to where this is? I want to see this. This is really important.
This way.
So you're telling me if you push this way,
exactly, yeah.
it feels better here.
Yeah.
Yes?
Yeah.
Okay. So there's a lot of information in the history when you're asking questions with a patient.
Yeah.
Okay. And there's some good information there as well.
Right.
Okay. What else makes it feel better?
Back in again about 5 years ago.
Yeah.
Same thing happened. Right. I was lifting something, and I think it was a pretty heavy piece of kit that was being lifted by a few other people. Just when it was about to trip and fall, I just put my hand underneath it while my body was cold. And I think that's something else that triggered it again.
Triggered another episode.
Another episode, right.
So you've had 2 major episodes.
Yeah, correct. Recently, last year, just trying like different things to like, you know, fix my back. I went in for a physiotherapy. That sort of like absolutely crashed me down, right? You know, I thought it'll help, but it sort of totally knocked me down.
What do you mean?
It sort of that I never used to be in that much pain before the physiotherapy, but after physiotherapy, right, you know, my pains sort of went extremely, like, you know, beyond control.
So hold on, what were you getting done then? So if you started physio last year,
yeah, in October,
and it was for your back,
for my back, yeah,
and it was for a still diagnosed herniated disc,
yeah. Yeah.
And what are they doing for rehab for a herniated disc in the UK?
Right, well, they were actually doing they started off with stretching, body stretchings, and I think in that something happened that, you know, after the second session, right, you know, I was like completely on bed.
Were you on your back getting your legs stretched?
Legs stretched, yeah.
Side?
Back being tilted to the side, right, you know, being stretched again.
Okay.
You know.
All right, and now it's affected quality of life. You've had to fly over the pond to get here.
Yeah, certainly.
And then another flight.
Yeah.
Okay.
Yeah.
All right. So let's figure out what's going on. Is there anything else I need to know? Whatever else I find along the way,
sure,
I'll point it out to you.
Okay.
We'll fix whatever we have to fix.
Right.
Okay.
That's good.
All right. You sleeping?
Not comfortably.
Okay. Are you waking up in the middle of the night?
I am, yeah.
You are.
Yeah, shifting pillows under my back, neck. Oh, sorry, neck is another problem.
Okay.
Right. If I sleep straight, like all night without a pillow, I'm fine. Wake up without pains in my neck. But if I keep the pillow at night time, wake up in the morning, extreme pain shooting up my neck, up my head.
So we have to address this too, and we need to look at the film. So if someone is telling us that I sleep on my back, I sleep flat, and it's fine. Well, we're designed to have very specific curves, right?
Yeah.
If we don't have the curve, then the question is, do we have a straight neck or a possible forward neck?
Right, okay.
And that's possible. We'll look at the film and see.
Okay.
Okay? And then we'll figure out a game plan for you.
Sure. No
So number one is back,
Yeah.
right side.
Yeah.
Pushing from the left
Pushing
makes
from
it
the
feel better.
Yeah.
Neck.
Yeah.
Neck is, it's more when you're laying on your back flat.
Flat, yeah.
It's comfortable.
Yeah.
When you put a pillow or you're leaning forward is when you're feeling it. Right now you're working, studying.
I've got a business phone, just working.
Okay.
Yeah.
Are you at the desk a lot? Are you on your feet a lot? You're
Driving a lot, I would say.
Driving a lot, so you're sitting. There's a lot of sitting
yeah.
happening.
Yeah.
A lot of traffic out there.
It is, yeah.
Decent amount of traffic.
It doesn't help.
So we'll make a few recommendations
Okay.
to help hold things for you. Okay.
Okay. Now things right with my back pain, right? The pain actually shoots down my left leg.
Okay.
It goes all the way behind my knee.
Okay.
So
Left side down to your left knee does not go into your toes.
No.
Okay.
Toes.
So possibility and things we're going to look at is we will look at L5 sacrum. We will go at the foundation, at the pelvis.
Okay.
Because when you fell or when the injury happened, it's not just that one thing went out. It's all connected, right? And the biggest thing that's not looked at is what? The pelvic balance.
Right. Okay.
So regardless of what's happening at L5 or L4 sacrum, if the pelvis is not level and balanced, nothing really holds according to our philosophy, our opinion in this work. This whole work is based on what? The foundation.
Yeah.
Okay?
Yeah.
He's been watching.
Okay.
He's been learning. Why don't we do this? Why don't you stand up? Let's watch you walk.
Sure.
Okay, come over here, please. And let's tuck the back of your gown in. We even got a special treat today that we'll share later on, and you may be the first patient to experience it. All right, let's go ahead. We're going to watch him walk back and forth several times, please, as he's walking. This is your normal walk, yes? Okay, keep going. So you can see he got the Birmingham wiggle, right? You got the Birmingham wiggle. Okay, you do. Keep walking.
You see it?
Check out his left side. Okay, yep, that's the Birmingham wiggle with the left foot swing. So you're walking like this. Your left side goes up, right? It's up, and you swing your foot like this.
Right. Okay.
Okay, keep walking, please. So there's definitely an issue in the foundation we need to address. Keep walking. And now watch his feet. Let's look at his feet. So there's a little bit of a challenge here.
Right.
We need to discuss this. Come over here, have a seat. Let's go over your x-rays. Okay, so let's get an overall presentation of what's happening here. If we're looking here first at this, just a general appearance before we start analyzing, yeah?
Sure.
What do we see? What are some things we see? Does the pelvis look level and balanced? It looks slightly off to that left side.
On the left, yeah.
Slightly, right?
Yeah.
I'm not so much worried about this. This all looks decent. We have a little bit of a tilt going on here. But again, I'm not so much concerned about this at the moment.
Right.
Okay? And the reason why is we have healthy straight spines. We have healthy curved spines, tilted spines on this film.
Right.
What's more important is on this x-ray that we have the right curves. We are designed to have 60-degree reciprocating curves.
Right.
60 degrees forward. Let's zoom in on this one, please.
Okay.
60 degrees forward. In the neck, which yours is what? A reversal. And that's what we were just talking about earlier, right? Okay. And as we go down, you actually have a straight spine. We need more curve in that spine.
Right. Okay.
The good news is your discs are good. Okay, 5 is a little bit less. Now 5 anatomically is a little bit less,
Oh, is it? Okay.
typically, just a tiny bit. But yeah, there was an injury there. This held beautifully, your L4 disc, that's almost textbook.
Right.
All right, and then these are compensating. L3 you can see tilt, but this here you can see, let me zoom in here please. When you look here, you're looking at the undersurfaces of the bone because of the slight tilting on the other film, yeah? But the main thing on this, let's zoom in here now, is there's something going on in the sacrum, and I'll explain why in a minute.
Sure.
Okay. Yes, there's L5 here, L4. Something is going on here though. This doesn't look right to me when I'm looking at S1. It almost looks like S1, there was that old injury and it's kind of just healed a lot of scar tissue here.
Right.
Okay? That's what I'm seeing. Now, if we go to the A to P, we're going to go to the numbers in just a second.
Sure.
But let's get an overall appearance. Let's look at the joint space in the SI. Compare this to this. This looks a little more swollen on the left SI, just slightly swollen. Okay? Left side looks down just a little bit, right? And if we look at this hole and this hole of the obturator, does one look smaller than the other?
Right.
The left side or the right? The left is a little bit smaller.
Left one,
yeah. Okay. So now let's go to the analysis and see what we find. This is the analysis of the foundation, okay?
Right.
And this is going to give us a lot of information now. Okay, so what do we have here? Let's look at the numbers. We have 234, 228, we have 60 and 67, and we have a slight leg length inequality on the left. So first thing is this. So we talked about a level foundation and a level base. Your base is off slightly, but it's still within limits.
Right.
What Gonstead found, anything under 7 millimeters, adjustments will still hold.
Okay.
You're 2.8. But this is what the challenge is here. You have on the left an AS ilium, which means this. The left pelvis goes up. Okay? There's not a lot of rotation here in terms of left to right side in the pelvis. So here's what's happening. The left pelvis goes up. The right pelvis goes down. But then the left side tilts a little on the left side. The sacrum then rotates on the right. So let's put it together. Left pelvis goes up, right sacrum goes back. That's the disconnect in your low back. Okay? And as a result, what's happening here is we're getting some calcification in these iliolumbar ligaments. So there's, your left is what you're saying about the shooting, but your right is also stiff. Okay? Do you see what I'm talking about here? Yes?
Certainly,
Okay. I'm talking about this here. This
makes sense.
There should be a nice lucency in through there. And it's not poop. Excuse me. Okay? Alright, so we have a potential left AS ilium. We have a potential right rotated sacrum on this film. As we go up, let's go back to the AP and let's follow it up now. Okay? Now, as we go up, sure, we have something happen.
Yeah,
here.
I was going to question that. Yeah.
Something happened. Look at the shape of the bones.
Yeah,
also,
sort of.
look at the shape of the ribs. There's a big kink in here.
Yeah.
And that, well, where did it come from? The question is that a trauma, or is that compensating that it needed a specific or a significant compensation to whatever's going on down here?
Right. Okay.
And if that's the case, either way, this thing is gonna need to move around. So things are gonna feel a little uncomfortable, possibly in that midsection,
Right. Okay.
as things shift around.
Okay.
Okay, I just want to be clear on that.
Yeah, sure.
As we work our way up, okay, as we work our way up, same. So this, whatever happened here, is throwing this entire upper back out, right to about here. The atlas, upper cervical, the capsules look good. We have a little bit of rotation on the axis. Jaws, we have a potential, possible on the right side. Potential.
Okay.
Possible jaw issue on the right. We'll check. Okay?
Sure.
Those are all the things I see on the x-ray. Any questions?
No.
Pretty straightforward.
Okay.
Now let's figure out what we see on you. The base of the neck. And let's run the meter and see what we get. And the first thing we're getting is right around that mid-back area. It breaks 15 right around T6, T7. That's around that area I was showing you, okay?
Right.
All right, let's continue on. T6, T7. So I didn't get a chance then, I guess, to explain the challenge. So we have a slight short leg on the left side. Right. If I push that pelvis down to fix that pelvis first, guess what's going to happen? It's going to make that leg length inequality more potentially.
Right.
So my suspicion is we're going to start down low in the sacrum somewhere.
Sure.
And we need to do it in a way to torque the left side up. And I'm getting it down at S1, S2. Now let's go ahead and check the neck. Now we're getting heat, but I'm not really getting a break here.
Right.
So what does that tell us? A lot of compensation happening up top.
Because of the lower back?
Correct, and the mid back here.
Mid back as well, right?
So here I'm not getting a true break. I'm getting just heat.
Which could be swelling or something?
Muscle activity.
Right.
Just it's trying to compensate and hold things in place.
Right, okay.
These are your two majors I'm finding, sir.
Okay.
Now let's go static palpation. Head down, please. Good. As we're running the fingers down the spine, let's watch the fingers. You can see it starts to orange peel here, swell all the way to there. You feel that one?
Yeah.
How about that one? Not as bad.
Not as bad.
Right
this
there.
one is more, yeah.
And you can see a little pimple there too. Little stop sign. 1, 2, 3, 4, 5, 6. Number 7, sir. 7. You may have heard me talk about T7. It has a nickname. I'll let you think about it. Go ahead and scoot forward, please. Straight, please. Is this you sitting up straight?
Yeah.
Sit normal. Got it, okay. Feet touching. Open and close your knees, please. Open and close. Feet are touching? Yeah. Right side only. Watch my thumbs. When he does the right, the whole left shifts, you can see. Okay, left side only. When he does the left, the whole right shifts. And that's what I was talking. You have that left pelvis, you have that right sacrum.
Right sacrum, right.
So scoot back for me, please. No, scoot your butt back for me. Thank you, sir. And come back straight. Now, let's look at 5. 5. That's S1. That's it. S2. S1. Right side.
I'm feeling it more up the top.
You're feeling it more, when I do this, you're feeling the top.
The top, yeah.
That's the compensation you're feeling.
Right, I get it.
Okay?
Yeah.
The cause is down here, you're feeling compensation up top. When I go left, do you feel it?
Not as much.
Not as much.
Yeah.
Okay. Walk again, and we're going to make a decision where we're going to start. Go ahead and walk, please. Never been adjusted.
Never been adjusted.
This is your first adjustment.
First, yeah. First.
Wow, okay,
Yeah.
this is going to be fun. So this is his first adjustment.
It is.
Let's see if we can get rid of the Birmingham waddle, okay? The Birmingham wiggle and waddle. All right, so here's what I want to just explain.
Yeah.
Two things. There's a sacrum, spine, and there's a pelvis issue.
Right.
When there's a pelvis issue, you're saying there's shooting pain down, it stops to about the knee.
Yeah.
That's typically, we think, pelvis.
Right.
If you're telling me it's going all the way down to your foot, then we're thinking what? More spine.
Right.
Typically now. There's
Right.
always exceptions.
Okay.
Now, between the two,
Yeah.
we have to decide where do we start. Is that more of a bothersome nuisance, the left side or the right side?
It's the left side.
Okay, so you're going to make my job fun today. Okay. All right, let's get started. Let's put your chain over there, please. So what we're going to do is, we're going to do, if you're okay with it, I'll do it since you're coming from far.
Yeah.
We're going to start with the sacrum.
Okay.
And the reason I want to start with the sacrum is I got to get the torque to get that left side up a little bit.
Right. Okay.
Then I can bring the pelvis down.
Right.
Okay?
Yeah, sure.
I don't, as you know, you don't typically do both together.
Right.
I have started to do it and getting the results with it.
Right.
There are a couple of things that I'm going to recommend you do in order for it to be stable.
Sure.
Okay?
Yeah. No,
Now, we're going to start over here today, sir. We got a new table, guys. We got a new, this table just came from Denmark. It's an electric knee chest table. You mind if I explain it?
Yeah, sure, go ahead.
All right, so I'm going to show you how to get on it. The difference in this table is there's not a lot of adjustments of the wood pieces, so it's a lot easier for the patient as well. And the way you're going to go on this is this. You're going to put your feet here. You're going to just rest your chest on it like this. And then what I'm going to do is I'm going to demonstrate by bringing it down and bringing it up what the ideal position is for T7 versus sacrum. It's a completely different positioning. Okay?
Yeah.
Come over here, my friend. Are you ready?
Yep.
Let's do it. Let's do it. Okay. Shasha, you ready?
I'm ready.
All right. Okay, sir. So you're gonna just put your chest here, face on the top there, please, and hands on the side. Now, here's what I want to demonstrate on the table. It's really cool. Bring your knees up just a little bit, please. Good. Now, if we're looking at this, we want to be adjusting the high side. So if I want to adjust the low back, ideally I'll bring the front piece down just a little. This is now the high side. So if you look from here, you can see this is the high side up here. And here's what's really cool. So now let's say we're going to T7. We want to elevate this a little. That's it. Okay? There's not a lot of messing around there. You can place your hands here. Aram se, just right there. Okay? All good? 1, 2, 3, 4, 5, 6. Yes? Okay. And nice and easy, T7. There we go. 1 second. T7, there. Gotcha. Relax there, please. Okay. You okay, sir?
Yep.
You're a little tense. Can you breathe, please? Bring your chin up a little bit. That's it. A little more. Bus. You're a little tight, my brother. Bring your chest down slightly. There you go. And we're going to do S1. I'm slightly on the right side of S1. I'm going to torque it into me and up. So I'm on the right side of S1. I'm torquing into my knees here this way. That's a little bit, sir. Drop it down. Gotcha, home run. Come on up, sir. You okay? That was deep. Now, what was interesting for me on that is it wasn't a big crack.
Yeah,
but it's set in there. I don't know if you felt that.
I felt it, yeah.
Right? Walk it off, please. Keep walking. You went from a wiggle to a jiggle.
Is it
it's less.
Can you see?
It's a little less already. Watch. Okay.
I've been controlling and living with this for like quite a while now, so
it'll take a little bit to break that story. Go on the orange table, please. Let's just slide up a little more, sir. Okay. I just want to get more of this T7. Be a little more relaxed. There it is. Do these tight. Gotcha. You did feel that one.
Yeah.
That was it. Let's get a little more through that joint. I'm on the right side, torquing up. Oh, there's the rest, my brother. Gotcha. That's the home run, sir. Stand up and walk it up. We had to go a little deeper.
Yeah. I felt that.
You okay?
Yeah. Yeah.
Watch his pelvis, please. It's different.
It is, yeah.
Yeah. Keep walking. And then we're going to run the meter on your back.
Sure.
And let's see what's different. Have a seat over here. So first thing is just sitting, sir.
Yeah.
Deco.
The difference right away?
You'll see the before and after. Right. Is this you just sitting normal now?
Yeah, that's just
okay. Now, we started on T7 and the S1, yeah? Mm-hmm. Things will be shifting around. Right. Your big thing while you're here is walk as much as you can, okay?
Sure.
T7 is clear. S1 is clear. Let's go ahead and read motion and see if I need to do this pelvis today. Scoot forward, please. Feet together. Open and close your knees. Good. Right side only. So now when he does the right, the left doesn't shift as much.
Feels a lot lighter in English compared to before.
One more time. It feels lighter.
Yeah, it's a lot easier to do it now.
Now do your left side.
Still a little
stuck there, yes?
Yeah. The right one I could feel it's really good.
I'm still doing the sacrum though, not your pelvis right now. Let's go left side down. Want more of your sacrum. Head over here and face that way, please.
I felt quite sharp pain while doing that, right at the bottom, just in the middle.
Okay.
I'm not sure what was that. So it was pretty sharp pain. It was.
Right now?
No, it was when you did that, right? Just while you were touching it, just with a little bit of movement as well. I was feeling really sharp pain.
That's
in the
the pressure on the disc.
Is it right? Okay.
That's the pressure. What it was, right? That's exactly what we're getting here.
Okay.
Go left side down, please. Yep. But you're not feeling it now. Hopefully.
No, I'm not feeling it.
Okay. Bottom leg straight. I mean, this is also his first adjustment.
It is the first one.
So it's kind of interesting. Slide forward, please. There you go. Bottom leg straight. Now we're going to get a little more of the rotation here now. Yep. Straight ahead. There you go. Hold there. And we're going to be right on the right side of sacrum, S1. And we got to torque it. What we said, we're not going to torque it up this way. We need to torque it down. Right? Gotcha.
That was quick.
I didn't want you to think about it.
No, that's a good thing.
I didn't want you to think about it, dude. That's good.
Yeah.
Come on up and walk it off.
That was a good one.
Good stuff.
I think if you tell me in advance, sort of my brain starts preparing it, my body like
That's what you were doing on the black tape.
stiffening the body.
That's exactly what you were doing there.
Yeah. I guess he decided to trick me.
Your foot is going to feel a little different on the right side.
Right.
Okay, keep walking. It should feel a little different as you're walking right now. Sit on the floor, please.
Relax.
Just sit however you want to sit. All the way down.
Okay. Like that, straight?
Yep. And now what I want you to do is go ahead and stand up.
Don't go down.
That's not straightening.
It never goes down.
Okay, so now this is something we didn't see. You didn't mention this, did you?
No.
That's okay, this is important.
Yeah,
So-
that doesn't go down, and while I'm standing straight, I can't bend forward because of this.
Okay, so now
Feel
there's
stretch.
another piece to the puzzle here, guys. You guys don't want to make it. Yellow, let's do your pelvis. Come on, right side down, please. Good thing I had you sit down, right?
Yeah.
That's kind of important. Go on your side here, right side. No, over here.
Oh, sorry.
On your right side, yes. That's kind of important, dude.
Sorry.
Huh? Don't you think?
Yeah, it is. I think my body's full of problems, right? So it just.
I think you're just compensating a lot, okay? There's just a lot of compensation.
Looks like it.
That's all. Bottom leg straight, top leg bent. Slide your whole body forward. Forward. I'm going to be on your glute. Is that okay?
Yeah, sure.
I got to ask, right? I'm going to be here. So from PSIS, we're setting an AS. So an AS, fingers are going up, and we're going to just bring it straight down, okay? Through the shaft of the femur. And we're gonna go straight like that. Gotcha. Home run. Come on up, sir. Walk it off. Yep.
I'm feeling better. It feels a bit lighter.
Okay. Sit on the floor again. Let's see if it changed anything.
Is that it?
Yep. Okay, now when you're doing this is important, we're going to figure this out.
Yeah.
You're feeling it.
Stretch. Another stretch. Yeah. Feel it? It's like completely tensed
It's been like that for a while.
for a while.
Long time.
Yeah.
We're not going to mess with that right now.
Okay.
The idea is this, let's get the body in balance, let it release on its own.
Okay.
If we need to do any scar tissue work and stuff, we'll do that later.
Great.
Okay. Come back over here, have a seat please. Let's remotion the pelvis. Right side only. Little different.
Yeah.
Left side only. Little different.
Yeah, it is. Yeah.
Yep. We still got scar tissue. I'm going to start breaking up this scar tissue, okay?
Okay.
I need to start working on this. The movement is better, but because there's so much scar tissue,
Yeah.
you're going to see that shift still a little bit, okay?
Right.
So let's go ahead and start breaking that stuff up for you. Oh, good. You're getting your buff polished with slight exfoliation. And he did complain of his neck. I did not touch his neck first visit. Right? Because I didn't find as a cause coming from your neck today. Now, as you do more and more walking, things start shifting around, something may show up, we'll deal with it then. I will work on your ankles today.
Okay.
And your shoulders. So let's go ahead now and set your shoulders. Okay, let's go ahead and set the shoulder. Over, around, down. There you go. Over, around, there you go. On your back, sir. And let's set your ankles. This is all part of kinetic chain, right?
Right.
Low back, sacrum, pelvis. There as bad as it looks. Yours doesn't look bad anyways. AS talus, medial tilt. AS talus, medial tilt. There you go. And we're gonna set a little bit of the fibula down here. Okay, just a tiny bit on the posterior side. There you go. Stand up and walk it off. And you can tell us what's different now.
Feels a lot like the body does.
So let us know after on your next visit.
Yeah, sure.
Yep, stand over here. Let's go ahead and check your hands. Squeeze. Good. Squeeze. A little bit on the radial head on the right side. Here we have radial head, distal radius, lunate, scaphoid. See the joint. Squeeze my hand. Much better. It's like this now. You were like this before.
Oh god, I didn't notice.
Squeeze. This one is more on the distal radius here. Let it go. There. Lunate. Scaphoid. There you go. Squeeze my hand. Solid. Old habits are hard to break, aren't they?
I think that's what it is.
Okay. A little more. There it is. Squeeze. Squeeze. Okay. That's where we're going to start.
Sure.
Your homework, easy. Water, walking, ice.
Okay.
You're going to walk at least an hour a day.
Okay.
If you want to do more while you're here, please do more.
Sure.
Lots and lots of water.
Yep.
I'll give you a few ice packs. You'll ice at least 3-4 times a day.
Okay.
With or without pain. There may be a little soreness. Things have been like that for a while.
Yes. Yeah.
Okay?
Yeah, it's been a pretty long
and
time.
let's see what happens over the next couple of visits.
Sure.
Okay?
Yeah, excellent. Great.
Welcome to the office.
Thank you.